Today I want to discuss the facial rehab, the timeline with this from your onset of facial paralysis, and what that looks like, and what the options during and after are. So when you are first diagnosed with facial paralysis, generally you're going to freak out. You're going to possibly think that you have a stroke, and for most people they will rush to the ER or urgent care, where they will most likely be diagnosed with Bell's palsy. Even if it's a different type of facial paralysis, the most likelihood is to be diagnosed with Bell's palsy. You'll be given some antivirals. You should be given some antivirals, as well as some prednisone initially. For most people, there's a few cases where people cannot be prescribed prednisone, and those are specific cases. But for the most part, most people will end up with going home with a prescription of antivirals and steroids. In some other cases, when it shows up with other symptoms, which has happened to a few patients lately, where they were diagnosed with much more involved neurological conditions, they were actually admitted overnight and monitored and went through a battery of tests. So the main thing to know is that it is very likely that when you go to an urgent care with Bell's palsy, you will not receive any testing imaging like an MRI or a CAT scan. It's more on the rare side. If the physician is pretty confident that it is not a stroke, especially will test your strength in your limbs and do other tests, they will likely not initially do an imaging test, and you should be aware of this. That way you are not necessarily disappointed if that doesn't happen. It is actually quite the norm to, unless they're suspecting of obviously a stroke or something more sinister, but for the most part people are just giving those meds and are just going home. You will be probably told to follow up with your primary doctor. In the US, we all know what that means. That can take quite a while to get into your primary doctor. Obviously, hopefully that's not your case. And then you will probably go to your primary doctor. You might be referred to an ophthalmologist after that, especially if you're really struggling with the eye, and that should actually be your priority. If you are having a lot of tearing, your eye is red, is irritated, you have a very hard time closing it, even if you are taping, patching, using chambers and all this, it would be a good idea to be assessed by an ophthalmologist, just to verify that the health of your eye is not declining quickly. This is extremely important. You could sometimes that can lead to blindness, so obviously not something you want. And then your primary doctor will probably not tell you much more unless you have symptoms that last, especially if you have pain or dizziness. If you do have pain or dizziness, I would highly encourage and request that you see an otolaryngologist or an ENT, ear, nose and throat doctor. And as well as if you have pain, you might need to be prescribed with some 𝗂𝗵𝘁. If you are diagnosed with 𝗟𝗵𝘁, so 𝗟𝗵𝘁 with the visible 𝗂𝗶𝘀𝗀𝗀 lesions, most of the time are in the ears. They can be on the face and neck as well, and inside your mouth. That is much more painful, so generally a 𝗂𝗵𝘁 might be required, and you should also likely be on antivirals for longer than a week or 10 days, according to the most recent study and medical practice in that regard. So generally, this is, for a lot of people, this is where basically the care stops, and then they just don't know what to do. they go to an acupuncture. For example, some people are having chiropractic. Some people, if they're lucky, will be sent to a physical therapist. The chance that it is a facial therapist is very small, and the effect and results might be extremely different if that is the case. So this is the time where I would encourage you, and hopefully you're seeing this video today, maybe you are one of these people, is to find a facial therapist. This is what I do, live and breathe every day, and I am available for consultation in Seattle as well as online in many places. I will include a link to submit your information and see if I can help you. Otherwise, I will help you find a therapist the closest to where you live. So once you're in facial rehab, hopefully things are going to improve. And again, being a neurological condition, it takes a while. It's a slow healing process. Be patient, patient, patient. Do not lose hope. Just be patient. Even during this therapy, if after, I would say, and it depends for everybody, but several months of, if you're really struggling, there's no change, you initially, then you're again regaining some movement, but then you are getting also again very tight. If you are developing complication like hemifacial spasm or synkinesis or crocodile tears, then that specialty physical therapist would also work closely with your ophthalmologist and or otolaryngologist in that regard. And this is when, if you do have synkinesis and severe lack of function in your face, so Botox might be really helpful for you at that point. And when I say Botox injected by either a plastic facial surgeon or a ENT facial surgeon. I would not go anywhere else. The little lady at your spa next door will not know her facial anatomy, not know the dosage. The dosage of Botox is extremely important with this. If you're getting too much, that could make things worse. If you're getting not enough, it could not be enough. And you do want to use the help of a professional for this. Really do not have your next door neighbor inject you with Botox. That's basically my recommendation here. So generally, once if you do have Botox, then you should be continuing facial rehab. It's not one or the other; it's both. Both are generally needed in order to see lasting effect. And after a while, if you were to really not improve, or if you've had flaccid paralysis from this entire time from the onset, after over 5-6 months, and there's really no return of facial nerve function, and or if you're having some severe synkinesis that is disfiguring, this is when consulting with a facial surgeon, otolaryngologist or plastic surgeon would be really beneficial, and you can go over all the various procedures that are available. Obviously, the procedure is would depend on your objective findings, what's going on, what's working, what's not working, what is synkinetic, what's your overall presentation, and also how are you doing psychologically, and so many different level and factors will enter in that decision. So again, it's not the spot to talk about all the different procedures. There's so many different ones, and I'm not going to do that here, but just so you know, you are not alone in this. You might feel like you are, but there is a huge community of people that either went through this, that are here to support you. The difficulty might be finding us and finding the right person. I will leave all my coordinates and contacts in the bottom of this post. I am here to hear you. I'm here for you. I am here to help you. And if I can help you, then I can also recommend likely someone to see where you are. Obviously, I am based in the US. I will know and have names for you more so in the US than abroad, but here I am. So I hope this was helpful. I hope this kind of give you a timeline of possibly what to expect. And of course, the Botox part and the surgical procedures are really just appropriate and warranted if you have not recovered after 6 months, which is generally the window of time between 3 and 6 months that everybody is given initially when diagnosed with Bell's palsy. So once again, I hope that was helpful, and you have a great day. Keep up on staying positive with this. Stay compliant with your facial rehab. I hope you do have a good program that is appropriate and effective, and if not, there are people to help you out there. Have a great day. Take care.